probably 3 to 4 years. I've been working with young people who have experienced criminal exploitation and gangs. And there is no real training in the NHS of understanding why people join gangs, how to work with them, kind of supporting them out of that. So I wanted to it's my special interest, so I wanted to kind of get a bit better understanding and have a qualification that's recognised for working with young people who are violent and obviously involved in gangs. I kind of had an idea of why people got involved in gangs, but not really the theory and kind of understanding how it impacts on them. So that was kind of the main reason that I wanted to get involved in it, to understand, because I always get to the point where they're quite entrenched. So there was different ways that we were marked, so it wasn't all just writing. But what I enjoyed most about the course was the fact that all the people were from different backgrounds. Not everybody was a professional. So I felt that gave us a good sort of learning experience. Because sometimes when you just have professionals, it's not the same as somebody having lived experience. I've learned so much more, especially like about marginalisation. Kind of that's not something I've really thought about in depth. And actually how to portray that to other professionals. I was able to expand my knowledge, and I feel I can use that now when I'm talking to other professionals about what they need to do to improve the outcomes for this young person. Give me more confidence. Because before I was kind of like, I could say, well, I think this, but now I can say to people, I've done this course and you need to do X, Y and Z. And I suppose my colleagues that I work with, they see me as the expert. So they come to me for advice and understanding about push and pull factors. So that's good. My manager's been quite clear that before I started at my team, they didn't really touch the gang kids because nobody knew what to do. But we're taking a lot more now, which hopefully will improve the young person's outcomes. I think if you want to help shape changes, it's definitely the course, because I think lots of small changes make big changes. And I think even as like one individual professional, I think you can impact and make changes to other professionals, which then will make changes to young people's experiences and how they're viewed, and their self-esteem and self-worth. I think if they're seen just as gang members and nothing else, why are they going to engage with professionals or services and make changes?